Forget frequently asked questions.
Common sense, common knowledge, or Google.
How about advice from a real genius? 95% of people in any profession are good enough to be qualified and licensed. 5%
go above and beyond.
They become very good at what they do, but only
0.1%
are real geniuses. Richard Jacobs has made it his life's mission to find them for you. He hunts down and interviews geniuses in every field: sleep science, cancer, stem cells, ketogenic diets, and more. Here come the geniuses. This is the Finding Genius Podcast
with Richard Jacobs.
Quick note before we begin, the Finding Genius Foundation, as part of the Finding Genius podcast, has recently completed a book about understanding viruses. So the creation of this book was to interview 100 virologists, ask them a lot of deep, difficult questions, take the most difficult questions, and then re-interview the top 25 or so and ask them the hardest questions I could think of. And we compiled that all into a book. So you'll see question and 4 or 5 experts' answers. Question, 4 or 5 experts' answers. There's about 30 questions in the book. I think it's a great read for the layperson and for the researcher. It talks about a lot of speculation in the world of viruses, such as are they alive or not, and why is it important? Why do viruses go latent or hidden or ineffective or sit in a person or an animal or another creature for weeks, months, years, and then suddenly become virulent and affect that person? So there's a lot of really provocative questions in the book. It's now on Amazon. So if you go to Amazon and type in Finding Genius, you'll see the book on viruses. It's also on Kindle. The Audible version is in production and should be ready in approximately a month. But if you want to go and order it now, you can do so again by going to Amazon or Kindle, or go to findinggeniusfoundation.org and go to publications. There's an opportunity as well to get the transcripts of all the interviews and to hear the original interviews themselves. If we put them all together, the book would be about 1,000 pages, but we condensed them down to make it juicy and concise and tight and very interesting. So I hope you'll check out the book. We're now working on one about cancer, but this is going to be our goal is 3 times a year to come out with these masterclass books that I think will inspire new scientific research, and I hope you'll check it out. Thank you.
Hello, this is Richard Jacobs with the Finding Genius podcast, part of the Finding Genius Foundation. I have Dr. Gary Foresman, MD. He's a medical doctor and internist. He's the founder of what's called Middle Path Medicine, and we're going to talk about his integrative approach to cancer therapy and regenerative medicine. So, Gary, thanks for coming.
It's great to be here.
Yeah, if you would, tell me, is your practice just clinical or is it research as well?
It's entirely clinical practice. Middle Path Medicine has kind of been, it's actually been my business name for almost 12 years now, I think, as far as that goes. And kind of this approach where I do my own practice where it's, for quite some time, I had heard people saying, hey, Western medicine says this, and they kind of point to one side, and natural medicine says this. And the truth I've always found is in the middle. And obviously in a very polarized world, Middle Path Medicine is almost like an anomaly.
Well, standard of care and everything is like, it's just radiation, chemo, surgery.
And that's what we try to get across to people is that this is what standard of care. If you see an oncologist, even if you see 3 oncologists and they go to the best centers in the world, you're going to get basically one opinion about what to do, and that there's many other ways of looking at cancer out there.
So what is your approach? How do you look at cancer?
Well, and I know I shouldn't say I know this. I've looked at a few of the podcasts, and you've had Thomas Seyfried on and the metabolic approaches to cancer. And I think that is a part of the answer to looking at how do we look at this disease we call cancer, and how do we transcend some of the thoughts both in Western medicine, and also you see the same world in the natural medicine world too, where if you go to an integrative cancer conference, if you want to start a fight, just start talking about diet, or a bunch of natural people that we're so attached to our approaches that sometimes we don't bring the person into the conversation. So in terms of my approach to integrative cancer therapies is that the person is there to make the choice about how to approach their cancer. And sometimes that means a more Western approach than I would do. Sometimes it means even a more natural approach when I think a certain form of targeted chemotherapy for their very specific form of cancer might be the better option. So it's patient-oriented, which is really what integrative medicine is supposed to be, which is providing tools to your patients and allowing them to make better informed decisions about how to approach cancer. I mean, we can dovetail off of that, but it even comes down to the diet approaches, yes.
Well, in regards to diet, I mean, if you live, 85 years, the only thing that goes into your body is liquids, air, and food. So how could it not affect you and all your cells? That makes no sense. But I guess that's
of course. Well, again, goes into that. Within natural medicine, there's this basic tenet is that nutrition treats people and not diseases. And it's one of the things I really try to focus on with people, because if they've come to me and they say, Gary, or Dr. Foresman or whatever they're saying, Gary, how do I approach heart disease? What diet should I have for heart disease? Which diet should I have for cancer? For the majority of people, they're missing the point. It's which diet should I have for me? Okay. Because, and we'll of course get to later stage cancers in just a second, but because the basic truth is nutrition treats people and not diseases. And through the transitive property, if they give the right nutrition for that person, then you will find that form of nutrition will treat that cancer. And of course, as you probably are well aware, an ounce of prevention is worth a pound of cure. So that form of nutrition is going to be right for them for prevention as well as treatment. And what that means is, so back to my experience going to many, many integrative cancer conferences, and the thing I was saying about the attachment that different doctors have to their dietary approaches, because they still are doctors out there in this world who are still afraid of fat, believe it or not. They think eating any fat is a cause of cancer, eating any animal protein cause of cancer. Of course, there's the fungal theories and a whole variety of other ones out there that each doctor group tries to, sell to their patients that you have to juice to treat cancer. You have to eat this way to treat cancer. And of course, for the majority of people, essentially they've become a disease that so happens to have a person as compared to a person who so happens to have a disease. And that's where we lose it in Western medicine, especially, is we're treating diseases. We're not treating humans. Because as you well know, each human who has any disease, and this is true for cancer, for heart disease, for anything, autoimmune disease, is you're really trying to diagnose the person and not diagnose the disease. And so, of course, and this takes us to the metabolic approaches to cancer, the further you go along in a disease, the more serious a disease is, it is important to treat the disease more so than the person. Because the kind of joke goes like this: if somebody is hard to stop beating, you don't ask them what body type you are before we do CPR. We do CPR because we have to save your life, and your history is kind of irrelevant at that moment, assuming we want to save you.
I mean, regular medicine is fine with emergency acute stuff, but this is more chronic. So what? Correct. Again, what is your overall method for treating people? How do you assess them, first of all?
And that's the part. So when they come to see you, you ask them about, this is back to the treating the individual. Okay. So the most common cancer I see is breast cancer. And each of those women who, and I'm just going to use that as an example that we could obviously dovetail into other forms of cancer. Each of those people have a story behind what is their history, what is their dietary approaches, so that have led to what they associate with this cancer. So if there are people who've come to me with any system of eating that have had breast cancer, at this point, yes. Okay. For the most part, when you look at this lady who wrote Radical Remissions, for the most part, you have to switch their diet because the human organism, to get better, has to make a change. Okay. And if you look at the idea of using ketogenic diets for everybody, especially for the people who are stressed about that kind of eating, they've grown up, they're vegans, they're juicers. The stress of changing their diet that radically can be actually make them do worse. I've seen the same approach, of course, with people who are doing macrobiotics. I've seen it where I thought macrobiotics helped people, and I've seen it where it's probably killed because of the stress factor. So the idea is to ask them, this comes into treating people, and that's what we were saying is it's a clinical practice. Is the research we're doing, as they say, a research with an N of 1, right? Which means each person you see is their own clinical research trial. Of course, you use data to talk to them about the best approach to their cancer, but especially when it comes to the breast cancer, as there's so many societal and sexual and other implications that many women carry with this cancer, that you have to ask them about that before you even get to their diet. So, what is your stress levels? How are we dealing with that? Where do you see this cancer coming from? And so that's the key. So I've had patients with any form of cancer, colon, breast, etc., where the first thing we talk about is actually their relationships and their stress levels. And yes, of course, we get to the dietary approach to it. My basic template for diet, I'm sure you're aware, is actually I start with the basic paleo principles. Paleo diets are very straightforward. You should eat like a human because you're human. You should avoid processed foods and processed, not just the white stuff, but basically foods with labels. And I do think grains are the most pro-inflammatory foods that we find in anybody. So if I can get them to cut out processed foods and inflammatory foods like grains, I actually think we've gotten the vast majority of the benefits of diet that we can get for them. That's the primary thing we do dietarily is say, listen, start with paleo. Now, and paleo is the template. You know how this is that people want to make dietary systems into belief systems. And we're trying to just say, hey, the Paleolithic diet just is the basic, the perfect human diet, whatever term people are coining out there is you should eat like a human. Tough to argue with that. You should eat real food. Tough to argue with that. Your carbs should come from fruits and vegetables because the biological response modifiers known as carotenoids and bioflavonoids and oligomeric proanthocyanidins and all the other cool things that make fruit and vegetables so interesting to the human that talk to your genes. Those are the things you need to help fight off cancer. So get, locally grown organic foods and you will be talking to your gene profile, helping your immune system function and helping with this programmed cell death thing that we talk so much about with people with cancer. And that's how you really get to it because, is keto the right diet for everybody? It really isn't, but it's a great diet when you have stage 3 and 4 cancers because now you're getting towards treating the cancer more so than treating the person. For most people, we're treating the person more so than the cancer.
What do you think about what is diet affecting? I mean, I know it's kind of a strange question, but why, if I eat something processed or if I eat grains, why does it inflame me? Why does it not work well with me versus something unprocessed? What do you think at a biochemical level is happening? What's the difference?
Before we continue, I've been personally funding the Finding Genius podcast for 4.5 years now, which has led to 2,700 plus interviews of clinicians, researchers, scientists, CEOs, and other amazing people who are working to advance science and improve our lives and our world. Even though this podcast gets 100,000 plus downloads a month, we need your help to reach hundreds of thousands more worldwide. Please visit findinggeniuspodcast.com and click on Support Us. We have 3 levels of membership from $10 to $49 a month, including perks such as the ability to see ahead in our interview calendar and ask questions of upcoming guests, transcripts of podcasts you're interested in, the ability to request specific topics or guests, and more. Visit findinggeniuspodcast.com and click Support Us today. Now back to the show.
Well, again, obviously there's multiple levels of answers to your question. So let's start with the kind of simplest thing. So, processed white foods. So talking about things with high glycemic responses and high insulin responses. So the first thing you're looking at is, I'm sure you're well aware, is that the PET scan is using a tagged glucose molecule. And we do know that cancer has radically increased, depending on the cancer, from 10 to 40-fold increases in insulin receptors and glucose receptors. So we know that the fuel for cancer is primarily the glucose molecule that we need. I should say we need as well, which we can run on as well. But we do know that radical shifts in our sugar and in our insulin levels, sugar serves as a rapid fuel for cancer. And the increase in insulin, most people out there know that insulin's primary job isn't to lower blood sugar. Insulin's primary job is to store the sugar somewhere. Okay. And that's usually in fat, which is the primary thing we're concerned about in terms of long-term cancer risk, but also is used to help get the high insulin receptors. The increase in insulin will make sure that the tissue with the highest level of insulin receptors will actually consume more glucose. And this, of course, is going to be the cancer cells. So the first level of that is if we cut out processed sugars, then we are doing a huge benefit for the person's overall health and especially, decreasing one of the fuel sources for the cancer. The other side of it really kind of comes from all the toxic things that we find within our food supply. But the main thing I would be concerned about are the excitotoxins, the glutamates and the monosodium glutamates, all of the excitotoxic artificial sweeteners that people shoot for. You'll probably find this I found this in so many of my keto patients is they found from some quote unquote authority that to use these things with tons of artificial sweeteners, which are absolutely, horrible for human health. And we got to treat the person too. And so if we can cut out.
when people say that, artificial sweeteners are fine, are they just looking at the glycemic response and nothing else? Like,
That's it.
where do you find the toxicity and where do you not?
I think Blaylock, did the book on excitotoxins, The Taste That Kills, I think was the subtitle to that. But, and he had a lot of good research on that. The problem comes is that people have learned to be so afraid of sugar that they don't look for almost anything else. And I had a next door neighbor who just showed me, does your little baby, I have a 2.5-year-old at home, by the way, and does he want a pops? Yeah. Does he want a popsicle? And it's like, well, as you can imagine, I said, well, what's in that popsicle? And she goes, well, it's sugar free and it's gluten free and it's fat free. And of course, no popsicle should have ever had, fat or anything else like that. And the label is what this lady who was trying to be nice, showed all this, the artificial colors, the artificial sweeteners. And it was like a popsicle should have fruit juice, water, and maybe some citric acid as a preservative. So people have become so stuck on the sugar-free thing and that what it doesn't have that they don't even look for what's in there, right? And I see this even for my cancer patients, like, well, I'm using this bar from wherever. And I say, let me look at the bar. And they haven't looked at all the processed ingredients in there. So, that's takes us back to that basic tenet. Doctor, help me read the food label. And the answer is, if it has a label, it's probably not a food. And so, but back to your question, which is, does our body have the ability to process the level of chemicals that we're putting into it? And I just think it goes back to the same thing that we find in placental blood and embryo, the umbilical cord blood, is there's so many levels of toxins in our environment that are reaching it into our body that I don't think it knows how to process. And so I want to be clear. What are the consequences of this? So let's just take this back to the breast cancer. If you look at the studies mainly from Europe that look at breast cancer risk, it's total xenoestrogen burden, which is the greatest predictor of risk for breast cancer.
If you like this podcast, please click the link in the description to subscribe and review us on iTunes.
Now, most of those xenoestrogens are coming in topically, right? Xenoestrogens are coming in, but they're coming in from the plastics that we're drinking from our water bottles. They're coming in from our cosmetics. So xenoestrogens are the leading predictor of why a woman gets breast cancer, because it's a toxin that your body will store in the fat cells, and the breast is the canary in the coal mine of toxicity. It'll store these toxins next to a metabolically active tissue known as the mammary tissues. And that's why I think the breast is actually the canary in the coal mine of toxicity. So this toxic burden, this organic, which is why we're trying to get people to have an organic lifestyle, whether that's food, but also cosmetics and bath care products, etc. Can
you give me some names of, first of all, artificial sweeteners? I know we can't name all of them, but
okay.
A few predominant ones that are bad, and then xenoestrogens too.
Okay, so sucralose, acesulfame, and aspartame are the classic, artificial sweeteners to avoid. Saccharin was a bugaboo there for quite some while, right? But saccharin probably has less of a toxic effect than the ones that replaced it, which are sucralose, acesulfame, and aspartame, and so those are the artificial sweeteners to avoid. Xenoestrogens really are not going to be listed under the food ingredients, but they'll find anything that's basically that you're heating or cooking in plastics. And again, the plastic water bottles, that's the BPA and the BPS. Okay. And be very clear, BPA-free water bottles, meaning plastic bottles, usually have another xenoestrogen known as BPS, which is maybe mildly less toxic than BPA. The rest of the xenoestrogens you'll find in the families, you'll find actually in your cosmetic products, and usually are in the families that they call the fragrances and the parabens, which have xenoestrogenic activity. And so those are the things that you're trying to avoid from a prevention standpoint. But obviously this goes into, an organic lifestyle that we're trying to promote for people. Let this diagnosis of cancer make a shift in your awareness where you know that what you put into your body topically and or orally makes a huge difference in how you feel, first and foremost, but also liberates your body's neurological function, immune system function that are responsible for the recognition and elimination of things like cancers. Okay.
If you, for some reason or another, cancer won't eliminate the insults to your body, but you try to make it up by having good things, I don't know, bone broth, supplementation, exercise, etc., is there much of an effect? Or if you don't remove the bad stuff going in, are you kind of hobbling your ability to get healthy?
Yeah, that's obviously a great question. I mean, One of my foundations of health I do for people is an hour a day for healthy exercise, an hour a day for meditation, an hour a day for food and food preparation, which, as you can imagine, the meditators will tell you an hour a day for meditation is not enough. The exercisers will tell you that that's not enough time for exercise. And of course, the chefs in my practice will tell you an hour a day for food and food preparation, time for eating, not nearly enough. So it's an interesting question because so many people want to solve everything through diet or through exercise or through those meditative practices. And actually, to be well, I mean, this is preventive medicine wise. To be well, you have to do all these. And that's why especially with something as serious as most cancers, tell them healing is a full-time job. If they're willing to take time away from work, I will, write for their ability to use, to go through treatments. And by the way, when I say treatments, I'm not talking about chemotherapy usually. I'm talking about taking the time for food and food preparation, and taking the time for exercise, this return to the yin side of medicine, meaning the inward stroke, which is so powerfully important. And so do I think most people can heal when they just want to put all their eggs in the proverbial one basket, meaning I'm just going to focus on exercise and the dietary things aren't as important? Not for something as serious as cancer. I think they have to work on all levels, but they can do it with a form of joy about knowing how what they're doing is so important for themselves, how they can do it with a sense of more music in their life and more other things. So you tell them, you shift their awareness to things that are fulfilling them in ways that they thought that their foods were, and their too much TV and all the other things that they were filling their lives with. So you have to make sure that they're filling their lives with other things, not just taking things away, because that's the imbalance, especially younger doctors, and that includes me. Well, that includes somebody who used to be me. I'm not a younger doctor anymore. Is that we get so caught up in the things we tell them to do. Usually it's like I said, eliminate xenoestrogens. And then you say, hey, what does that mean? And you say, well, these are organic. And you lead them towards things that they do, organic skincare products that are good, etc. So as compared to just taking away the body soap that you used to use. And so to answer your question directly, I think you really have to make shifts on all levels to get the healing that I'm looking for. Because my patients who have these radical remissions from cancer usually found that they bought in, done what they need to do to make the shifts in all levels, because they realize healing is something deeper than just changing a diet, just changing an exercise pattern, taking up a stress management program or a meditation program. So it's really about doing all the above.
When you say all in, is it any more important if someone has stage 1 or 2 versus 3 or 4? Like, how much of a difference is there? What you need to do?
Correct. I mean, so stage 4, you have to buy in. I'm just going to say stage 3 and 4 have, for most of the cancers we're dealing with, including the breasts and prostates and colons and the things that the common doctor of integrative cancer therapies like me sees, that they don't make the shifts, they aren't going to make it. And the worst scenario is they don't do anything and they want the doctor to heal them. So they go to the oncologist, and this could be a radiation oncologist, a medical oncologist, and they say, diet doesn't matter. And of course, since they're an oncologist, they're going to listen to them. They're a cancer specialist, right? And so sort of not want to change their diet because they hear, oh gosh, diet doesn't really matter. My oncologist said so, or my radiation oncologist said so. And so if they have stage 3 or 4 cancers, then the doctor is supposed to heal you, right? That's the current medical model, that I give you chemotherapy and I heal you. And it's sort of like when we were watching Alex Trebek go through his thing with pancreatic cancer, and you saw, because chemotherapy is really good at knocking off 99% of cancer cells sometimes. It's just that it makes the remaining cells even more aggressive. So he'll go online and tell everybody, my numbers are down to nothing. And you know, as an integrative cancer doctor, that he's getting this advice. I don't know what else he did, but I know he was getting chemo, and he's making the underlying cancer more aggressive. And he has this illusion of success, because that's what people are looking for. My CAT scan looks better. My tumor antigen looks better. And chemotherapy, I'll be honest with you, almost always does that. Okay. And so, but what you've done is selected out essentially what amounts to being a more aggressive cancer, and it comes back with even more full force. And therefore the treatment really made no difference in the long-term survival. But if you wanted to look at 6 months, wow, it's pretty cool. So
same thing with Rush Limbaugh. He just passed and he had lung cancer, I guess, same thing.
Right, exactly. And you said short-term success. I followed Alex Trebek more than I did than Rush Limbaugh. But so that I can see, and from the outside at least, I looked a little bit. And so, but people they're drawn in with this short-term success thing, which chemotherapy almost always does, radiation therapy almost always does. And then they think, gosh, I don't have to do anything to heal myself. I just can let the doctor heal me. And that's kind of when Western medicine has them, why we've made almost no progress in terms of survival, because we do I'm sure you know, the cut, burn, and poison approach to cancer. And the person essentially feels that there's nothing they can do because they've been told by the medical authorities, like you were saying earlier, the standard of care, there's nothing you need to do. I can cut, burn, or poison this out of you. And it's an easy, passive approach, because who really wants to feel like they have to change their diet? Who feels like they really need to deal with stress management?
Yeah, it's weird. I mean, how could radical surgery and chemo? I mean, I guess people don't know until they've done it. But before doing it versus after doing it, I would think they're much more amenable now to doing diet and everything, because it's been so tough and so nasty to have this stuff done.
You would think so, but the other side of things is I do see people, so doctors like me who do the integrative cancer therapies, very often the person I will see has been through every round of chemo, surgery, whatever else, and I'm unfortunately left with a shell of a human being left. And then they say, well, now since my doctor said there's nothing else I can do, what can you do for me? And that's not the phase you want to catch people at, okay? And so those people usually, I'm talking more about, acceptance and end of life care, because the time to, like right now, I'm, writing articles about a lot to do with coronavirus and how you need to treat as soon as you even think you have it. Even if you don't, you got to get ahead of this one, because you have about 48 hours to treat a coronavirus. And that's obviously, you have much more time with cancer, but the same thing goes. If you really want to use natural therapies, early on is better than later on. And that's true for almost everything, and obviously including coronavirus for that matter. And even like I was, in the coronavirus world, people, it's like, really D and melatonin and IV vitamin C and other things would work? And the answer is yes, but they're always searching for a hydroxychloroquine or an ivermectin. Heck, even in the cancer world, a lot of people are searching for different drugs. And they say, well, I don't want to do chemotherapy, but can you put me on metformin, a statin, mebendazole, these other drugs that are used as well? And of course, I consider those drugs too, but they're just shifting which form of drug therapy they want, because all drugs are chemos, right? And so it's a different form of drug therapy / chemotherapy, but just different.
When you say all drugs are chemos,
right?
You mean to say all drugs will push the tumor in a direction of being more aggressive and not kill all of it and predispose it to being worse?
Great, and thank you for asking me to clarify. The statement really comes down to is what MDs are taught to do is the drug form of therapy for anything. Okay. So everything we do is a drug or a chemical. Okay. So the class is saying is all medicines are poisons. It's just a matter of the dosage. And that's true for a blood pressure pill. That's true for a cholesterol pill. That's true for a diabetes medicine. Okay. And so, but the term that people use chemo out there is usually meant for cytotoxic chemotherapy, meaning drugs that essentially treat growth. Okay. So that's what we talk about as being chemotherapy is these drugs that are used specifically for cancer. But what they don't realize is every single form of medicine we use is a poison of some system, whether it's poisoning a certain enzyme involved in affecting your blood pressure or some other things. So whenever you walk into an MD's office, you're essentially asking for poison. Okay. And most people aren't aware of that. No, I thought you were just going to talk to me about diet and exercise for my blood pressure. Nope. Drug every time, because you went to the drug specialist. So when I was saying cancer specialists really aren't, I actually don't think I completed that thought. They're really not cancer specialists. The standard oncologist is a specialist and using poisons to treat cancer. Okay. And they actually very rarely, they usually don't even know about the off-label uses of other drugs, other forms of chemos, meaning other drugs, as an alternative way of treating cancer. They're used to only using chemotherapy. And I'm not bagging on chemotherapy specialists. What I'm telling you is something you're probably aware of, is that an oncologist is not a cancer specialist. An oncologist is a chemotherapy specialist. Okay. And that means they should know more about chemotherapy than you or I do, which of course they do. And so, but they're not a cancer specialist and how do we know this? Because they don't talk to the person about stress or nutrition or exercise. I mean, there are studies showing exercise especially for colon cancer, is far better than most of the chemotherapy regimens. Okay. But does the cancer specialist really talk to them and really get them straight to a therapist for exercise? No, because there's no lobby for exercise. There is lobby for chemos. Okay. And so that's why we're trying to get across to people. And that's one of the benefits of the podcast such as yourself, is letting people know that, hey, the reality of dealing with cancer is if I went into this MD's office, I'm actually really specifically asking for chemotherapy, not advice about how to treat it from any other mechanism. And as long as we understand that, because this is true for every other doctor visit that anybody has with an MD, is they're going into the MD for some form of chemotherapeutic intervention. Okay. Now, whether that's a blood pressure pill or an antibiotic or whatever else, even for if it's not cancer, but it's especially true in the cancer world, because what happens when somebody gets the diagnosis of cancer from a standard MD is the standard family practice doctor or the standard internist, which is kind of my basic training, turfs you to your oncologist, meaning I wash my hands free of you. You're going over there. You're going to talk to the cancer specialist, and the cancer specialist is going to involve anything to do with your care. And that's too bad, because essentially you lost one of your best advocates, which should be your primary care doctor. And now you're free in the world, and your only advice comes from the chemotherapy doctor, and it says exercise doesn't matter, stress doesn't matter. All that matters is I give you chemotherapy, meaning healing only comes through the MD, which is a good business model, not a good treatment model. And essentially we have you in the system. Okay. And this is the toughest thing for people to hear, because you want to believe in your doctor, but the key is I'm trying to get them to believe in the actuality of what they are, is you believe in your chemotherapy specialist that he or she will give you the best chemotherapy available for your cancer. But that's it. That's all you will get from them. Okay. Because anything else about nutritional approaches, supplementary approaches, that doctor just doesn't know. So you better actually go to somebody else to take care of you.
Why is a primary care physician that says, hey, go see this person, goodbye, have a nice day? Mm-hmm. I don't know if they would be an advocate, but I guess, if you were in this situation, when the person said, I'm going to the oncologist, right, you would say, I guess I'm going to stay with you, though, because I can provide some insights that they may not have. Is that what you do differently?
That's definitely what I do differently, because I tell anybody with a diagnosis like cancer, that gives them a jolt of fear. Okay. And, they want to know that they're getting the best of Western medicine. There's no reason why I wouldn't want them to have that viewpoint, but I try to get across to them that it's a limited viewpoint system. These are the chemotherapeutic and or radiation therapies and or surgical therapies that we use in Western medicine. If any of these people really looked at all the other data, they'd realize we have not made much progress in treating this, and they would look somewhere else too. Okay. And I mean, everybody. The guy who wrote The Emperor of All Maladies, he did a great job. His last name is Mukherjee. It won a Pulitzer Prize. I think he does a great review of how we used to look at surgical oncology, how we used to look at radiation oncology, et cetera, and how Western medicine has been shaped by this. And even though this guy is a medical oncologist, his big hope these days is we won't use standard chemotherapy. Everything will be targeted chemotherapy. That also has its limitations. But he grew up in a system that everything is chemotherapy. So of course he wants to believe in it. So when I talk to people about Western medicine, because most MDs really are considered basically like high priests of the Western medical belief system, they really don't practice medicine anymore. They practice a belief in drugs or surgery or whatever they're doing. And so that's what I find the average MD to be, is somebody who's become a high priest or priestess of Western medicine, which is a very dangerous thing, because they're using a belief system to treat people. I believe in drugs, as compared to the actuality of all the things that we can do to treat cancer, including nutrition. It's a very interesting thing, because across the world, people are more open about all kinds of therapies, because usually if you have something like cancer, if it's mainland China, they're going to say, well, if you have cancer, let's look at everything. And from herbs to diet to spiritual practices and including chemo, if you're seeing the Western version of the Chinese medicine physician. And so we're looking at what are my best options. And we're looking at it from a much more holistic standpoint. Whereas in America, that's where I know the most about, obviously. This is true from what I've seen from Canada and Europe as well, too, in terms of doctors that I know from those areas, is that it's a very limited form of therapy. And so it's...
How do you deal with patients that, do you have to, so if someone comes to you and they have cancer, do you have to give them the standard of care? Do you have to offer it? Are you going to get yourself in trouble by not?
Well,
in
that's
terms of,
great question. And what I would tell you is that yes, I actually make it clear to them because it's part of most people's belief system. Say, listen, this is the name of an oncologist. And usually it'll go like this. This is an oncologist that isn't too afraid of the things I do as compared to being in support of it, right? So you need to work with doctors that at least aren't afraid of natural therapies, which in the oncology world, trust me, is very difficult. So these doctors, this is a radiation oncologist that knows what I do. This is a chemotherapy doctor. You need more information. You want to know, and your family wants to know, that you're getting the best of Western medicine, but here are the limitations. And this is where you have to be careful, Richard, because, if you take people's belief in their doctor away, and they think the doctor is the only thing that can heal them, you've actually kind of screwed them up a little bit, right? And so it's a fine line to play. So the answer is, I do this from a standpoint of yes, you need to see an oncologist to get their ideas about and get their data points, because they should know some more data points. Maybe there's a new chemotherapy routine that I've not heard of that has had increased success in their type of tumor. They need to hear about those things. And so is there a liability issue for most doctors? And of course for me as well too. But the reason I would tell you that I tell people to see an oncologist is they want to get more data, and the oncologist should know more about chemotherapy than I do, but they better, right? But you're correct. For many, the turfing from the primary care doctor is usually the liability things. They don't want anything to involve with treating the person with cancer, because it's such a scary diagnosis, and people might get mad at me if I try anything that isn't standard of care. Whereas my experience is that standard of care is usually what tells me what I shouldn't be doing. So I have to look at it much different, is that the people have to be aware of what standard of care is, but they have to be smart enough to know that there's little fragments of truth within it, right? And so, as a typical example, it's like my patients who take the statin drugs. Statin drugs work in the face of especially secondary prevention and treating cardiovascular disease. So there is a role for them. However, just lowering everybody's cholesterol is a horrifically bad strategy using those drugs, but that's what standard of care says to do out there. So, and what does that have to do with chemotherapy, with oncology, is because for decades now, through online, through advertising on TVs, people have started to believe that the only thing they can do for treating anything is a drug. Okay. And so, and if you start to go that way, before you know it, you're part of a populace that the only thing I can do to treat a cancer is a drug. And if you believe in that, firmly enough, if your voodoo is anything that isn't drugs, then you have to be careful, because anything I do would be therefore voodoo. Okay. And so you have to work within that person's belief system. That's why it's so important for everybody out there to be looking at improving our ability to see reality, which is a combination of book smarts with a wisdom tradition of some form of meditation, so you can see things how they are. Because most people don't seem to be able to extract or discern from, if they're even reading, if they don't seem to be able to grasp that knowledge and when I say discern, toss out the stuff that doesn't seem to be real and bring in the stuff to them that is important and real. Because there is crap within everybody's medical system, whether it's Ayurvedic medicine or it's Western medicine. And there's pieces we have to extract out of all of them to find something closer to the truth.
So I know everyone's different. I know every situation is different, but are there any stories that stand out at you that are interesting that you can talk about?
Yeah. I mean, because remember, the doctors who write the books about these and the ones who do most of the lecturing, usually they'll do some best of their greatest hits, right? Because you wouldn't do your stories of the person who came to see you and then, within months was dead, because that happens to everybody who treats patients with cancer. Okay. And so it's a hard profession. That's another part of this things too, is that there's dealing with people with these, illnesses is actually quite tough on my staff, me as well too, by the way. So of course you have these great stories. Okay. So cancer doesn't grow too fast. It dies too little. And so that's, by the way, I'm quoting somebody else and I'm just blocking on who. There's a lot of truth that an escape from programmed cell death is a huge part to many cancers, especially true for prostate, but for other cancers as well, is that they're really not growing too fast. Don't get me wrong. They are growing too fast, but that's not the primary problem. It's that they're dying too little. They've escaped some mechanism of apoptotic cell death, meaning programmed cell death, whether that's self-destruction or little signals that you send to the immune system for destruction. So there's a medicine known as low-dose naltrexone. Have you heard of that one?
I've heard of naltrexone. I don't remember what it's for.
So low dose naltrexone has its own little, following out there. It's a low dose of this anti-narcotic medicine known as naltrexone. The standard dosage is 4.5 milligrams nightly. Of course, it can vary quite a bit. And it causes a brief suppression of endorphins and then a rebound increase in endorphins. The net effect of this medicine is to increase endorphins. Endorphins aren't just the feel-good molecules. They're important for helping with one of the mechanisms of programmed cell death. So the story I'm going to give you is a very wonderful lady who, for some reason, told me when I saw her that I was only allowed to give her 2 things to treat this metastatic cancer she has. It was called metastatic Merkel cell tumor. It's an unusual cancer, and we don't have to get into it, but and I looked at the tumor type, and since she gave me this parameter, I'm only allowed 2 things. Basically, I told her to change one aspect of her diet. I'm sorry, when I said, this is the one part of your diet I need you to change, and I'm going to give you low dose naltrexone. And the low dose, and she had this tumor everywhere in her body, multiple bone metastases, lots of bone pain. Within a week, her bone pain was gone. Okay. And when she allowed me only to do 1 scan, which was within a month, she had something like 80% tumor reduction. Now, for everybody out there listening, this is a far, far different than you'll see because I've used low-dose naltrexone and it hasn't worked in some people too. But with this type of tumor, I figured it would be very successful. And it did lead to pretty much dramatic programmed cell death recognition by this tumor. And she lived for many, many years afterwards and died of congestive heart failure more than 10 years later after this diagnosis. And so using this one form of really a low dose of a medicine, she had dramatic improvement. I was not allowed to do any other scans on her after a few months because she had no more problems. And why would she bother scanning? This is what it's like dealing with real people, by the way, and not being part of research protocols. And so yes, by doing this one intervention, we had profoundly affected the course of her life. I usually will throw everything at people who have metastatic cancers, by the way. And the reason I'm using this example is because when I have successes when people are doing intravenous vitamin C and they're using an injectable form of immunotherapy called GCMAF, and they're using other things as well, and they get better. Of course, you and I both know we don't know for sure which one of those interventions worked the most. Was it that mistletoe therapy, etc.? So in a clinical setting, when you have especially stage 3 and 4 cancers, it's of course with stage 4 because she had it spread throughout her body, you usually throw everything at them, right? You're not throwing things one at a time because that makes no sense. You have to deal with so many mechanisms of action within the cancer. You deal with this improving apoptotic cell death. By the way, the main things I use are low-dose naltrexone and melatonin. High-dose melatonin, which is 20 milligrams a night, is probably one of the most profoundly beneficial things you can give to anybody, whether they do or do not do chemotherapy and radiation therapy.
Really? Why?
Yes. There's great.
Wouldn't it suppress your own melatonin production?
Well, again, when you're dealing with life-threatening cancers, who cares? I mean, sorry, but and for the most part, melatonin production, let's use that as an obvious one, especially in the cases of coronavirus, by the way. From age 20 to age 50, melatonin production drops 50%. By 70, you're barely on impulse power, gone by 75. That's 75 years old people. And so I have everybody over 50 on melatonin just for prevention of disease, period, just because they're already losing their melatonin production. But the dosage of melatonin we use in treating cancer is like 20 milligrams, and it can be used much higher too, by the way. Why is that? Because there's type 1 and 2 melatonin receptors in every cell of the body, and it's one of the mechanisms that you can stimulate that using extra melatonin, everybody, through these melatonin receptors for stimulating this apoptotic cell death, which basically, once again, means helping with cell self-destruction, which is a normal, natural process for any cell that is beginning malignant transformation, transforming into cancer, or already is cancer. So it seems to be a mechanism that is still intact in most cancer cells. Of course, many cancer cells eventually escape many forms of treatment. But you use melatonin and low-dose naltrexone for, just to talk about it, for one mechanism of action for dealing with apoptotic cell death. It's very profoundly beneficial. And the nice thing about melatonin is if the person does chemotherapy or radiation therapy, you dramatically decrease the side effects of chemotherapy and radiation therapy, even though it has some antioxidant properties, which is always the big bugaboo in that world. So just using some simple examples is everybody who has cancer, and I'm talking about, significant cancers, not just a simple, if somebody has a simple basal cell cancer, which is a skin cancer, cut it out and move on with your life. I love simple everybody. And so, but cancers are fairly complicated. And so, if I can just work on this one area, program cell death and helping that, then the other area you really like to do is improving immune system function. And that's where the injectable forms of therapy, whether you use mistletoe therapies, which helps with natural killer cell function. I use a lot of stuff called M protein, which is the GC-MAF. It's a GC protein-related macrophage activating factor. So we use this forms of therapies to boost immune system function. And of course, we would prefer that if the person doesn't do chemotherapy, can help them if they're doing that. So we're doing things that chemotherapy can't. Okay, so just be clear. Many people out there will choose to do standard of care because they're afraid to otherwise, or their family members say, please mom, or please dad, or please daughter, please do these things because they believe in them. And so you have to kind of work around the fact that they're doing these treatments that often will kind of get in the way of your therapeutic success. And so, but you do it because it's part of that person's working belief system. And so there's just a sampling of things that an integrative cancer specialist will start working with you in terms of helping you should you decide to do chemotherapy or not do chemotherapy, because you leave that locus of control with the person. But there's a variety of things that we do to help improve them. And we all have cases where we attribute their treatment. Like, for instance, I use IVC a lot, and you get dramatic. IVC is high dose intravenous vitamin C, everybody, and usually in combination with other forms of therapies to make it work better. And you have dramatic improvements in cancer and tumor burden. And of course, you follow this like any other doctor with PET CTs if necessary. Tumor antigens are better because it's better to use the blood biopsy, as they talk about. So there's so many ways we have of treating people that go beyond the standard of care from a Western medical standpoint. But it's a very comprehensive approach, and it's supposed to be patient driven, meaning that somebody sees me on one day with stage 3 or 4 pancreatic cancer. They should be getting similar advice, but they could very often choose different approaches to get to the same outcome, because once again, treating the human who has the disease is what a natural medicine physician is supposed to do, whereas Western medical physicians focus treating on the disease that so happens to have the person. And sometimes both approaches are necessary, but that's why there's more and more. I got some certification through the A4M group, which is the American Academy of Anti-Aging Medicine. They have a fellowship in integrative cancer therapies. There's other groups that do the same thing, but it's good to also, align with other doctors who are doing similar things to you, so you know what's out there in the world. And you also have to know what your state licensing board tell you to do, and try to keep a low profile, because the last thing you need is, too much. When you do things beyond standard of care, they sometimes become liability issues like you were asking about earlier. And so you got to be careful about those things. Stick with things that are proven to work. Have evidence about what you do working. But, do I always wait for double-blind placebo-controlled trials to work on these things? And the answer is no, because they're simply not going to be done in our country. So you try to find the best evidence. And just for the audience and for you, the doctor world uses this thing called evidence-based medicine. And you think, well, Gary, what doctor shouldn't use evidence-based medicine? Evidence-based medicine means if there's a double-blind, placebo-controlled, randomized clinical trial, that's what you should be using. And of course, that means that's only drugs or surgery or some other intervention that is supported by the current world that will you ever find that has that evidence. Therefore, evidence-based medicine means you can only use drugs or surgery. So no, you have to go beyond evidence-based medicine. You have to find the best evidence using the best safety versus risk profile of whatever intervention you're using. You have to be kind of motivated to look for something beyond, standard of care.
Well, very good, Gary. We're just about out of time. What's the best way for people to find out more? Can you do telemedicine, or do they have to be local to you? And if so, where?
I mean, as you probably imagine, the last year has increased the amount of Zoom meetings I've been doing, et cetera, because I personally, kind of old school, like to see people, and I like to have them in front of me and touch them and all that other stuff. And because there's something about the intuitive side of medicine that I do better in terms of seeing people, which of course has led to the Zoom meetings and things like that. So over the last year, we're doing more, with people in terms of all forms of integrative medicine, in terms of treatment, at a distance, so to speak, and less giving people advice. Obviously, if you want to do high-dose IV vitamin C, you have to come to someone's clinic, right? But some of these other things we can talk to people about through our website, which is www.middlepathmedicine.com. And so that's the best place to reach me. And we have a series of articles up there on cancers as well as a whole variety of other subjects. But the best place to reach me is through the website.
Very good, Gary. Well, thank you for coming on the podcast, and I'm glad there's people out there like you instead of just the standard, which doesn't seem to be working very well.
Sorry, I just, I'm happy to talk to you about more specific subjects in the future if you so wish. But I was just trying to give people a general feel of what an integrative cancer therapy doctor such as myself does. Is we hopefully can treat you as a person and help guide you in making decisions, so you don't get all of your evidence of what to do on the internet. You try to go to a doctor who's done this and hopefully treated your form of cancer many, many times and can tell you what their successes and again, what their failures are too, because we're real people who've had failures as well. So, but anyways, yes, thank you for having me on.
If you like this podcast, please click the link in the description to subscribe and review us on iTunes.
You've been listening to the Finding Genius podcast with Richard Jacobs. If you like what you hear, be sure to review and subscribe to the Finding Genius podcast on iTunes or wherever you listen to podcasts. And want to be smarter than everybody else? Become a premium member at findinggeniuspodcast.com. This podcast is for information only. No advice of any kind is being given. Any action you take or don't take as a result of listening is your sole responsibility. Consult professionals when advice is needed.